Good afternoon, everyone. My name is Melanie Paris, and I'm the Senior Director of Health Initiatives and Education here at the American Kidney Fund. I'd like to welcome you to today's webinar, Kidney Chat, Ask a Caregiver About Dialysis. We thank you so much for joining. This webinar is brought to you by Amgen, and we are very grateful for their support of the First 30 campaign, which provides vital information for people newly diagnosed with kidney failure, their caregivers, and the professionals involved in their treatment. So before we get started, I'd like to direct your attention to the control panel you should see on your screen. All participants are on mute and will remain muted for the length of this webinar. The chat box has also been disabled, but we do want you to ask questions. So if you have a question, click on the Q&A and type your question into the Q&A window. And we'll see your questions and answer as many as we can at the end. For those of you in attendance who are health professionals, we're glad that you're joining us today and hope you'll recommend this webinar to the patients you work with, your colleagues, and families of your patients. However, as a friendly reminder, this webinar is not accredited for continuing education credits. If you do believe your accrediting body may offer you credits for attending this webinar, we'll be happy to send you a certificate of attendance after today's session. All you have to do is email us at education@kidneyfund.org. Also, please note this webinar is being recorded and the recording will be available online next week. So you can share that with people in your network if they were not able to attend live. And now I would like to introduce today's guest, Frances Ashe-Goins. Frances sits on the American Kidney Fund Board of Trustees. She's an active member of AKF's Advocacy Network and was also one of our featured speakers at the 2019 congressional briefing on Capitol Hill. As a public health expert with years of experience, she's also an adjunct professor at the University of South Carolina College of Nursing and Arnold School of Public Health, a health consultant with expertise in nursing, minority health, and public health issues as well. But today, Frances is not joining us in the capacity of her professional credentials. Today, she's joining us to talk about her experience as a mother, caring for her daughter, Cheryl Davis, who passed away just this past February. Though Frances is a registered nurse and health educator, her role as a mother took over when she unexpectedly learned her daughter had an issue with her kidneys. Frances cared for her daughter, Cheryl, who lived through 2 kidney transplants and kidney failure for more than 30 years. As you will soon hear, Frances is immensely passionate about sharing her experiences with other caregivers and people living through kidney disease so they will know that they are not alone. Frances, thank you so much for joining us. We are so honored to have you with us today to share your story with our audience.
Thank you very much. It's really good to be here.
Well, again, I can't say how appreciative we are that you're here to talk about being a caregiver to your daughter for so many years. And we would just love for you to start by telling us your story and what inspires you to speak to our audience today.
My daughter Cheryl was my heart. She still is my heart. She's in my heart. Some days I can't believe that she's not upstairs, and I want to go up and check on her. However, I won't talk about that because that was just February. But anyway, let me tell you a little bit about my story, because what I found over the 30 years that Cheryl was on dialysis, that there's a lot of things that happens in the healthcare system that as a nurse, I didn't know those particular specifics, but Cheryl's diagnosis, Cheryl's treatment, Cheryl's dialysis taught me a lot of things. You would think on Valentine's Day, the best gift I ever had was the birth of my daughter in 1973. She had a great life. We lived in Germany for a while. We were in DC. We moved from South Carolina. We were very, very happy. But who knew that 17 years later, in 1990, as she was getting her annual physical exam so she could go to college, we found that her blood pressure was sky high. It was 200 over 110. I knew that this was serious. but I didn't know what was wrong. So after all the testing, they finally called me after about 2 weeks and told me bring her in to the pediatric intensive care right away. And but they wouldn't tell me what was wrong. Um, at that point, when we arrived at the hospital, and they put her in intensive care and hooked her up all the monitors and everything. They told me her kidneys had failed and she needed to start dialysis. My mom came with me, and mom started praying. Um, as soon as Cheryl started on dialysis, she had her first seizure. Um, as a nurse, I knew what I was supposed to do. And so it was an out of body experience for me because I did that. I did what I do for any seizing patient and not let her block her airway. When the nurse arrived, she took over, and I realized this was real. This was my daughter. I've had several of those experiences over the years. Even though I was a nurse, professionally trained, and got a lot of education around kidney disease, I didn't get much about dialysis and the process, what happens. So when I would take Cheryl to dialysis, and I wouldn't go back home. I would just sit there and use this time to research kidney disease and dialysis. I knew that I needed to learn the specifics about this disease because my daughter was going to go through this, and I had to be on top of my game for her sake and for mine. Um, she got a transplant the first time, and we were so excited about that. But that lasted only 3 months. Cheryl's body rejected it. So now I need to learn about rejection and what the medicines and why weren't they working. And Cheryl was just devastated because she thought she was going to be okay. Um, we got another call another year later, and that was in 1995. And this time she was healthier. She knew what to expect, or so we thought. That kidney lasted 9 months. She'd even gone down on a trip from DC, where we lived, to South Carolina to visit my mother, and she had to be flown back to DC in a private plane, which was a cool experience for her. So there were good things and bad things that happened to her, but it was a cool experience to ride on a four-passenger plane. And they brought her back to DC, and she was in ICU. This time, her life was definitely in danger. I spent many days and nights in the ICU waiting room for the family. The nurses and staff, and that was Howard University. I'll give them a shout out. They were just so good to me. Um, but I worried because now I was spending so much time with my daughter with her various complications. I also had a son, but and he was younger. He was 9 years younger than Cheryl, and I thought maybe I was disappointing him. But it's one good thing to have some supported friends that they just took over for me and took over him, and that was just great. Um, people won't give up on you if you don't give up on yourself. And they saw my strength, they saw my passion, they saw my commitment. Over the 30 years, Cheryl experienced so many complications with cardiac tamponade, heart attack in 2010. During that time, we had gone to a circus, and she really wanted to go. So I put her in the wheelchair, took her to the circus. And while she was there, she said she didn't feel really good. And I looked at her and I told her, I'm sleeping in your bed tonight. And she was like, why, mom? And I said, because you don't look quite right to me. And it was a good thing I did. She woke up in the middle of the night with this awful pain. And she said, Mom, I got this awful pain in my back and it won't go away. So women don't have this typical cardiac pain on the chest. She had hers in her back. And I called 911. They brought her in. She was having a heart attack. The doctor says, well, we've got a 50% chance of her living and a 50% chance of her dying. I looked at him straight in the eye, Dr. Prosser, and I said, I'm going to take the 50% chance of her living. And she lived. And it's so interesting that even though that was the first time he'd met her, over the next 10 years in treating her and keeping up with her, she would always walk into the wheelchair, not walk, into the office. And he would say, "You still here?" And she'd look at him and she said, "You still here too?" So there were good times with all of this. Cheryl had a very good outlook on life, but that wasn't something that happened all at once. It took a lot of perseverance. It took a lot of her studying and about her condition and how she was going to live her life. I shared that I talked to Cheryl about if I couldn't be with her all the time, that she needed to write in a diary, write in a journal of what happened during the day. Put down everything that happened. Anybody came and talked to you and gave you a medicine or came for a test, write down their names. During that process, she started taking control of her own life. And when people would come in to say, "Oh, I'm coming in to draw blood," she would ask, "Why? What's the test?" And that gave her power over her condition. And it helped her. And it was a good thing because sometimes they had the wrong patient. Um, that wasn't the Howard Hospital, that was another hospital. But anyway, um, she learned that she was in control of her dialysis, she was in control of her kidney disease, and it was not going to get her down. As a caregiver, that was important for me. I learned that she could read me like a book. So before I would go in to see her, if she was in the hospital, if I go up to her room, I had to change my whole sense of what my facial expression was going to be, because she knew if she looked at me, then she would know either something was good or something was bad. And I learned to do that. And then later I would go down when I was by myself and boohoo, cry, and do whatever I had to do to get that out. I didn't want to keep it like in me. But it was just a way in the early years that I had to be strong for her. I had to be strong for her, as I said before, I had to be strong for myself. Even when she was feeling bad, she would check on me. She would say, "Mom, how you doing?" And I was like, "Well, you're the one sick." She said, "But yeah, you're the one that's old." I said, "Okay, darling." So we had
Mhm.
this kind of relation. Um, when she had this bad fall in January and needed cervical spine surgery, whenever she would go in for any surgery, we'd videotape. And on her videotape, this time she says, "Hello, everybody. I'm going to have another surgery for the umpteenth time. I don't know what the outcomes will be, but I've been through so many of them before. I'm a little scared, but it's okay. I know God got this." And that was her last recording, her last saying, which brings me comfort to know that she never gave up. She was a fighter. And she said she was never going to give up. She said, "As long as I'm here, I will be strong and not give up." She was a fighter to the very end. So that's a little bit about my story. A lot more stuff in between, but we'll go to some of the questions now. Thank you for listening.
No, thank you so much for sharing that. That was, very powerful, and I'm sure many people can relate to some of the things that you were saying. So, when people were registering for a webinar, there were some questions that they had, and I'm sure during when you were speaking, there was some. So at the end, I will make sure that we get to those questions. So as we're, thinking about your experience too as a caregiver, um, there's some questions that I think people may have, or things that you can talk about, um, a little bit more. So when we're talking about preparing for dialysis, thinking about your daughter's experience and also, your experience as a caregiver, um, can you talk about some of the different treatment options for people on dialysis?
Well, there are several treatment options. Hemodialysis, that's through the blood, and you can have hemodialysis with placement of a fistula, which is the preferred way. A fistula is connecting a vein and an artery together, or a graft, and in that way they put a tube in to connect the vein and the artery.
Mm-hmm.
And this hemodialysis can be done in a center, in a dialysis center, or you can actually do home dialysis. You have to be trained for all of that. The other one is peritoneal dialysis. A tube is placed in your abdomen, and you spend time getting this transfer of fluids. And a transplant is the most optimal treatment for people who are on dialysis. Once you get a transplant, either one, a cadaver transplant or a live transplant, then you have a new lease on life. Because I remember my daughter had her second one. She was like, wow, I can pee. This is so good. I haven't peed in years. Excuse me for my language, y'all, but
No, that is perfectly acceptable and it's real. So
yeah, real.
absolutely. Okay. And let's see, our next question here. So if you live by yourself and you don't have anyone to help you when you have to start dialysis, in particular with home dialysis, is it possible for you to do things on your own?
Um, it's much better if you can find somebody in your family or a good friend or somebody to just check in on you a lot. You're going to actually need support. Um, it's one thing as a nurse, I learned that people that bring people with them to the doctor's office, when the doctor or healthcare provider or nurse practitioner says something, um, you don't really understand what's happening at that time because it's happening to you. So it's much better to have someone that's with you that can help you understand what's going on. If that's not a possibility, well, in the state of South Carolina, I don't know about other states, but I'm sure there also exist in other states. If you are disabled because you're on dialysis, that there are services that your social worker can connect you to, which will provide in-home assistance. Now, it varies from state to state. That's the one thing I found out, that how states work and how much time they give you is differs from state to state. Medicare is federal, Medicaid is state controlled. So if you please talk to your social worker about getting some assistance at home, and please try to find somebody that can at least stop in on you, check in on you. That would be really, really great.
Hmm. Well, thank you for that. Navigating systems and finding resources, that's often a challenge. So the tips that you just recommended, I think are, very, very useful. So thank you. So, what would you say are the primary things we should think about when considering which dialysis treatment is best? You mentioned, some it's best if you've got somebody you can reach out to help you through appointments. But are there other things that you think should be taken under consideration for people when they're thinking about their dialysis treatment options?
Somebody there that's going to be trained with you. Um, so you can go to the American Kidney Fund website, and there is a section there for resources, or how do you make your decision based on the descriptions of the different kinds of options that are available. Talk to your healthcare provider, let them know what your situation is, and they can also give their opinion. But in the essence, it's up to you to decide.
Thanks for that. And I think that's very important, considering your circumstances and um, the support that you have, so that you can make those decisions for yourself. So here's a question. It says, my mom will be starting dialysis soon. How can I expect her to feel after her treatments? Is dialysis painful or tiring when you first start?
I'll give you Cheryl's perspective. It's painful. If you do hemodialysis, it's very painful because they have to use a needle to stick in your vein and your artery, and the blood is taken out and put through a machine and cleaned up and put back into you. Um, is it tiring? Yes, it's very, very tiring. Even though you're laying there, but the whole process of this exchange is tiring on your body. Um, they, the dialysis team will talk to you about anemia, which can occur from hemodialysis because you're getting it 3 days a week. And so you need to be aware of that. Your protein levels may vary, your other levels may vary. And so they give you a monthly report about how you're doing and what you need to do to make this better for you. And it's all a balancing act. The kidneys are a wonderful organism that keeps everything balanced, like your liver too. So if it's not working and it's working through a machine, there are some adjustments that have to be made, and your kidney team can help you to see where you are and how you can help get better balanced.
Mm,
But I will say that Cheryl, even though she'd had many, um, she'd been on dialysis for a very long time. She started like 2 years ago. She started sticking herself because she could better determine where that AV graft was, arterial venous graft was, and what was the best place to stick so she could get adequate clearance of her fluids. And then they said, well, you're doing so good now, you can do it yourself. And she said, yes, I can. And she did.
mm. Well, thank you for sharing that as well. Okay, so we're going to kind of shift a little bit into the lifestyle changes that people on dialysis can expect, or some things that are common, and also from your perspective as a caregiver for someone who has kidney disease on dialysis. So we read a lot about how to eat when you're on dialysis, and sometimes different resources have different information. Sometimes they conflict. So how do you know when you're doing the right thing?
You'll know you're doing the right thing when your balance is correct. Um, but and looking at resources for you, um, and websites, I worked for the government, so I go to the government websites. I went to the government resources at the Centers for Disease Control, and I did a search, and that's how I found out a lot of things that were in plain everyday language, not medical language, about kidney disease and dialysis and what you needed to do. Also, the National Institute on Health, NIDDK, National Institute of Digestive Diseases and Kidney Disease. I just searched for it and I found many pamphlets. I even found videos, and I found valuable sort resources. Another valuable resource is the AKF kidneyfund.org. That website had videos about kidney disease, including Kidney Kitchen, which I recommend because it told you about diets and how you can cook the food you need, and what's the best thing for you. But they also gave you financial resources, and there's a helpline that's free if you get, okay, I can't find the information. Let me just go there. Um, Patient videos in which people were talking about their experiences. It was very valuable when I looked at those sites also. But how do you know you're doing the right thing? When you feel better and your lab work comes back and it's better. That's how you know.
That's a good point. Also, one thing I wanted to ask you, what about working with the dietitian?
Oh yeah, yeah, yes, yes. The clinic, I forgot because the dietitian only came in once a month, I think. But the dietitian is there to help you look at your levels and let you know. if you're doing something quite not so good. The one thing I remember Cheryl telling me was that a lot of the dialysis patients thought that, okay, over they dialyze Monday, Wednesday, and Friday, so they figured on the weekend they could just pick out and eat anything they wanted to, because they thought if they came back to dialysis it would just wash it all away. And she was like, where did they get their information from? Dialysis doesn't take away everything, so you
Mhm.
still have to adhere to your diet. You can't like take a holiday. You can take a mini holiday, but not a really big holiday. Take out all weekend.
And that's a good point too. And that's one of the reasons I would recommend looking at AKF's Kidney Kitchen .org, because not only are there recipes there, but lots of different resources like food trackers and downloadables and just kind of tips like that. I think sometimes those tips and hacks are really helpful in adjusting to a new way of eating for a lot of people.
One thing I will say about that, um, when Cheryl started on dialysis and she had this low salt diet, and being from the South, we had high salt diet. So, but what we did, BJ, my son, did it very, he didn't want to do it, but he had to because I was doing all the cooking. So we followed her diet.
Hmm.
So we were all healthy in addition to her being healthy. And we knew that we were helping her. And after a while, it wasn't so bad. It wasn't so
Hmm.
bad. We followed her diet so that we could indeed also be healthy.
I
And
think
she
that's an
appreciated.
excellent point. Oh,
Yeah. So,
please go ahead.
if we were going to cheat, we wouldn't cheat around her.
But I think to your point, I think that's very important. If you're on a restricted way of eating and everybody else around you is kind of eating what they want as a caregiver or a support person, following the way the person eats that you're caring for can be very supportive and a nice gesture in supporting them and the new way that they have to eat. So the next question we have is, now that my friend is starting dialysis, will we still be able to travel and go on vacations?
Yes, 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 yes. Um, Again, my daughter was young, and I like to travel, and we all like to travel. So we found out that we could actually get dialysis in a city that we were going to. You had to do prior planning. You talk to your social worker, talk to your nurse, let them know where you want to go. They'll find out where the centers are, let you know where the general centers are, where you are going to be staying, and they will send all your paperwork ahead. The only catch is you might have to pay for some of that dialysis, but you're going on vacation anyway. Cheryl traveled with me to Florida, to New Orleans, to Maryland, several other places. And we found what she found out was that there were different methods. So she would bring the methods that she liked, the guidelines in a center that she liked. She'd bring it back to her center in Columbia and tell them, well, they do this in DC, and I think you should do this. Or she was like, their machines are newer than yours. Why can't y'all get some new machines? So it was an exploring experience, but it
Hmm.
was satisfying experience too. But you can travel.
Well, that's
And
good to
you can
know.
actually, well, maybe I shouldn't say that now because they stopped all the cruise lines. But a long time ago, they had dialysis ships. Maybe they'll come back to later. I don't know.
So you said they had dialysis available on cruises?
Yes,
Well, that's really good to know.
yes, yes. Because we were looking at the price is a lot higher, but it's still an option. It was an option, but prior COVID. Yes.
Well, thank you for that.
Yeah.
That's very good to know. Another question is, how can I support my loved one in initiating healthy habits to manage conditions like high blood pressure and diabetes? A lot of times people have these conditions, for years and aren't quite aware that they're risk factors for kidney disease. Um, can you talk about that?
Yes, again, that's the research. You find out information. You find out, first of all, people don't know what their numbers are when it comes to blood pressure, and they don't know what's high, what's low. They just know that they went to the healthcare provider and said, "Oh, you're doing good." Well, what's good for me? You need to know your numbers, so
Mhm.
you'll know as you go each time what's high, what's low. The other one is diabetes. They kind of know you need to keep your A1C below 7. 6.5 is good, but they don't do the A1 hemoglobin A1Cs that often. But they do sometimes check your blood sugar if you do a finger stick. And so that needs to be below 100. So there are things, once you know your numbers and you keep your testing, you can figure out, like, you can help the person as they're figuring out, well, what's good for me, and helping that person realize what's normal for them is just a way that they can take control of their own blood pressure and their own diabetes to know what's normal for them. And
Thank you.
again, eat what they eat, exercise when they exercise. Other good steps. Show your support that way. You'll be
Yes,
healthier too.
we all need that as well. Thank you. So now we'll get into some questions specifically about supporting loved ones who are on dialysis from your perspective, Francis, as a caregiver. So one question is, what is something you wish you would have known ahead of time about caregiving for a loved one on dialysis? In this case, your daughter.
Not to worry so much.
Hmm.
I worried a lot in the very, very beginning. I thought every time she went in the hospital, is she going to make it out? Um, and by worrying so much, it not only took a toll on me, it took a toll on her because she was always worried about me and how I was feeling, and therefore she wouldn't tell me stuff if she knew that I was going to be worried about her. So that did not help me. Now, as I'm reading back in her diaries from the year of 2013, 2014, where she complained about no seizures, no seizures. And I was wondering about this, and every day she put no seizures, no seizures. And I realized that she was afraid of having seizures again. And so every day that she did not have a seizure, she put no seizure, and that was a positive thing for her. But for me, looking at her and making sure she wasn't twitching or something like that, and that kind of put that on her also. So I need to learn. I need to learn. I still need to learn not to worry so much. Things will work out in the end. um, Appreciate her positivity, appreciate her independence, because that's what I had given her in the very, very beginning. So
Mhm.
um, take care of yourself. Take care of yourself also.
Well, thank you for that. Um, you know, that's such a good point that when, you worry, the person that you're worrying about can start to worry too. And to think about those things and just maybe another perspective that maybe we don't think about from the caregiver experience. So thank you for that. Another question is, I am a healthcare provider. What can I do to help patients and their families feel more comfortable when adjusting to a big change like starting dialysis?
All healthcare providers, even if you have 7 minutes, 10 minutes, or 15 minutes, and that's what the guidelines say, listen to people, listen to them first, listen to their fears, their concerns, their anxieties. Listen to them first, and that will guide you as to what you need to do as a healthcare provider to help them feel more comfortable about it. Going and telling people a lot of technical stuff in the very, very beginning doesn't really help them because they don't hear what you're saying anyway.
Mm-hmm.
So it's much better to listen to them, get their perspective on how they feel about adjusting to this, and then go with that first, because that's what's in the top of their brain. That's what they will remember, not what you need them to know, but what they need to know based on their own perspective.
Thank you. Next question is, my family member is on dialysis, but she doesn't want to talk to anyone about it. How do I let her know that I'm here to help?
That's really hard. Um, and I say it's really hard because um, she's scared. She doesn't know what's going to happen. And all you can do is to respect her fear, respect her uncertainty about her condition, acknowledge her feelings, and let her know that you're acknowledging her feelings. Listen to her, let her talk about how she feels. Be patient, be patient, and always be there. Um, People don't talk when they think you don't listen. And even though you don't want to give the perspective the that you're not listening, but being quiet helps a lot. I learned a lot of that in psychiatric nursing, that you don't have to talk all the time. Um, and then in the quiet space, things come out. And then the person can feel like, okay, I can let it out because it's really, really quiet in here. Somebody got to say something, maybe. But anyway, that's just my opinion.
Mm. Well, thank you. And I think on that, I'd like to mention that AKF just recently released a new component of our website on mental health and kidney disease with some really helpful resources and tips. I think if we can put that up in the chat, that link, um, some of you may find that information helpful. Okay. Next one, I would like to help my loved one or someone else on dialysis. How do I get on the organ donor list? That's a really important one.
Yes. Okay. Let me see that. Okay. Oh, um, the website for donation is donatelife.net. That's the website to register for donation. It's also on the AKF website. They have a description of donation and what it means, and you can explore that too. But the website is donate, DONATELIFE.net.
Thank you. And I think we can also put that up in the chat if anybody wants to take a look at that as well. So thank you. Well, here's one I think is, very, very important. So the question is, my life is busy enough and I just don't know how I'll be able to keep up once my husband starts dialysis. Do you have any advice for how to manage it all?
My life was very busy at when Cheryl was 17 and ended up in intensive care. I was on the National Commission on AIDS during the height of the AIDS epidemic. When Magic Johnson joined the National Commission on AIDS, and my role was to orient him to our commission and what we're doing. We're also doing a whole bunch of reports and everything. So my life was really, really busy. However, there is a time when you schedule out everything. You schedule out your work and you schedule out your caregiving time with your husband. Um, I'm helping him to understand that he also has the power and he can be in control of his dialysis and what happens to him, will relieve you of some of the things that he could do that you won't actually need to do. So being a partner, a collaborative partner in his dialysis journey is very, very important so that you continue to do the things that you need to do He does the things that he needs to do, and you, both of you, have the things that you need to do together.
Just following up on that, you mentioned earlier, Francis, that you had a network of friends and family who also helped to pitch in with some of caring for your son who was not on dialysis. How do you have conversations with your support network to pitch in and help if they can do that?
You ask.
Mm-hmm.
That's basic. People will say yay or nay. And then you find out who your real friends are and who are your conversational friends. So I didn't have a lot, but I had people that would show up. Friends were afraid themselves because, first of all, Cheryl found out about it do an annual physical, and people I knew didn't do annual physicals. And so they all wanted to start doing annual physicals, what they should have been doing anyway, to keep up with themselves. But anyway, but people will show up at times to do what they can do at that time. And so make your needs clearly identified to your family and friends, and see who will pick up the pieces. Everybody will not do everything, but if you have people doing some of the critical things that you need to do when you need to do it, then that will help.
Thank you. So we have some questions that have been submitted. Um, as we have been going through your experience with you, Francis, and also asking some of the questions that we've already had in advance. So here's one that I think is interesting about the care team. So the question is, how do I build my care team when I start dialysis? Will my doctor assign me a team?
Your care team is how do I say this? Your medical care team or your dialysis care team. So your medical care team is divided up into your nephrologist, the other people that are part of your medical team, and the doctor does that. Cheryl had a medical team that for every body part that went wrong, there was a specialist for that body part. But in the dialysis team, that team is already created in the dialysis unit that you go to. So there is a doctor that comes around to the dialysis centers. They are split up. Well, I could say in Cheryl's case, they were split up in the city by this big nephrology practice, and they were assigned different dialysis units to go to. So that doctor would come down and make rounds once a week, but they would have care team conversations with the charge nurse, with the tech that was helping with your dialysis, the social worker, and the dietitian. And that made up the care team in dialysis. Now, you are also a part of that care team. I found out that I could request a family consultation with the care team, and they would set it up. And then all the questions that I had about the care that Cheryl was getting, they would be there, and I could ask each one of those people about their aspect of Cheryl's care and what they were doing to help her. And
Mm-hmm.
that helped me a lot. First of all, it put them on notice that I cared, because everybody doesn't do that with families, have request a care team consultation. So that is possible.
Mm-hmm. Well, thank you. Another question. I have a 17-year-old son who has to do dialysis every night. I would like to know where I can get help. I can no longer work because I have to take care of my son at home. I need to know where to go for help. Where do I start?
You start with your social worker. Your social worker should know where all the care facility places are in your state. And I say that should because in Cheryl's case, I was told about the Council on Aging. And even though Cheryl was 17, they took care of people who were disabled. And I could get help for Cheryl at different times of the day. And that was the Council on Aging for here in South Carolina. What it is in your state, I don't know, but ask the social worker that specific question and see what they can do for you. Because your child is automatically disabled because they're on dialysis, and disabled people have a lot of services.
Thank you. So here are a couple of questions that have to do with insurance coverage. I'll combine them, but they are different. The first is dialysis covered under your healthcare system? And the second one, are anti-rejection drugs covered under the healthcare system?
Okay. Cheryl had Medicare and Medicaid because her father died before she was 18 years old. So she was covered by his Medicare, and she was covered by Medicaid because she didn't have any money, didn't make any money, and all of that when she turned 18. So it would depend on your state, and I'm certainly not an expert on insurance and coverage. I do know that when she had her transplant, they required us to have a plan for paying for the anti-rejection medicines after her transplant was successful. And there was no insurance that was going to pay for that. We were going to have to pay for that ourselves. And that's all I know.
Well, I know that sometimes it can be dependent. What I encourage people in our audience to do is take a look at our website. We have lots of different resources that address some of these questions, maybe some more specifically than others, but we do try our best to think of things that most people have gone through and have information on our website to address it. So if you may be able to find some of this information on our kidneyfund.org website. Another question, are there particular resources for caregivers that you found helpful throughout this journey with your daughter? Things that help you persevere, Frances?
My faith in God, one, helped me a lot. I know that AARP has a caregivers connection, and they have caregiver associations. So I would go to their website and see what they did. And that was about it. A lot of my caregiving role and caregiving aspects actually came from digging and looking up stuff for me. And that's what AARP came in for me.
Thank you. Another question is, staying positive. So the question is, how do we keep positive vibes for a kidney patient with everything that they have going on?
By finding humor and stuff. Okay, so in the dialysis centers, they become family, and everybody knows a little bit about everybody else's business. And so it became, when Cheryl would come back from dialysis, as tired as she was, I would ask her, okay, what's the story for today? What happened in dialysis today? And then she would tell me about who was taking who wasn't doing their medicines right, who was, it was just really funny stories that she would learn, and that helped her take her mind off of what was happening in her body at the time to what was happening with all the people in dialysis. It was amazing that the patients and the techs became allies uh, uh, in storytelling of who's going to tell the big story of the day. And that was real gratifying for her. Now, I'm not saying that happens in all dialysis centers, but she went to several dialysis centers, and it happened in that. They became a family. And so it was her dialysis family um, that she was always telling me about. And that was finding the humor in things.
So I think that is our last question, unless you can address this one relatively quickly. But can you speak to the quality of dialysis care based on racial and income differences?
No, I can't. I'm sorry. That is not I cannot talk about that because that hasn't been my experience in caregiving.
Okay, well, thank you for that. So I think that would be our last question that we can have time for today. Unfortunately, we do have limited time. So are there any final pieces of advice, Frances, that you'd like to share with our caregivers and loved ones about adjusting to dialysis?
The biggest thing for me, and again, I'll talk about Cheryl, my heart, is that the doctors told her at age 17 she would survive 20 years. So that would have been, she would have been 30, 20 years. Oh, I can't even think. It's 20 years to 7. Um, all along the way, I became determined that we're going to beat the odds of 20 years on dialysis. That she was going to be the longest living person on dialysis. And with that as my resolve, no matter what happened, I knew that she would come out of it. I knew that she would be okay. Um, I that was in my heart, that was in my head, that was in my brain. And in fact, a lot of doctors say that she wouldn't have survived as long as she didn't had I not fought for her. So I want all of you to fight for your loved one, fight long and hard, but take time for yourself also. You think that even though I was caregiving for Cheryl, that I didn't travel, I didn't go anywhere? I went to Africa 3 times. I went to Beijing, China. I've been to Canada 3 times. I've been in the United States because I love to travel. But I also took time for myself because I needed that time away and I need that time to regroup. So while you're fighting, take care of yourself also. Um, this last episode with Cheryl, I'm still trying to find out what happened because the surgery was successful, but a complication after surgery was what killed her. And so I don't know what that is, and I'm waiting on the autopsy. So I'm still fighting for Cheryl. Um, and that's my advice.
Well, thank you so much. The experiences that you've shared with us today, the advice is, it's invaluable. And it's something that we just want to have more of for our audience, these caregiver resources and sharing of stories. So we appreciate you so much sharing your experience, Frances, and about your daughter's experience. And this was just a wonderful webinar today. So thank you so much.
Thank you very much.
So this concludes today's webinar. Once again, I would like to thank Amgen for their support of the First 30 campaign and today's webinar. Please remember this webinar was recorded and will be made available for viewing on our website, kidneyfund.org/webinars within the next week. You can also visit kidneyfund.org/webinars for updates on future American Kidney Fund webinars. And again, please visit kidneyfund.org for various resources that we have available that could be very helpful. When the webinar ends, please do not close your browser window. Your window should be open for a new tab to complete the webinar satisfaction survey. We ask you please complete the survey. Your honest feedback will help us to make our webinar program the best it can be. Thank you for joining, and we hope to see you again soon.